Okay, we are here in Phoenix today talking with Rachel, and we'll be covering a number of topics specifically around mental health and the mental health system and homelessness and drug addiction. And Rachel is our go-to expert on a whole lot of this. So
Yeah.
Rachel, howdy.
Hey, Jesse.
How are you doing?
I'm very well today.
Awesome. Okay, can you tell us a little bit about your background
My background.
within mental health, within working with some of these at-risk populations and
Yeah.
this kind of thing?
Well, what launched me into the mental health field was my own experience.
Okay.
So just, a very traumatic and broken home as a child.
Mm-hmm.
And then from those experiences, having a really violent marriage for several years
Mm-hmm.
and ending up in the mental health system. Um, 20 years ago, the mental health system was geared around a diagnosis and the right medication. And then kind of those of us coming into the mental health system 20 years ago and having our own journey and realizing there's a real disparities in the broken system, getting to a place of our own journey
Mm-hmm.
to then step back into the brokenness of the system
Mm-hmm.
and advocate for those who we recognize could benefit from some changes. And so it was my own experiences and kind of walking through that, because of the level of trauma that my childhood was.
Mm-hmm.
I had dissociative amnesia. So I had these horrible memories and traumas that were driving a lot of my behaviors as an adult.
Okay.
But I hadn't ever had that safety and space, and the therapeutic help
Mm-hmm.
to allow those memories to connect and figure out the brokenness within me, until the last few years. And so I had lived in Phoenix from 2014 to 2018. I moved out here sober, 2 years sober. Started working for one of the larger insurance companies, that in Phoenix has a lot of large insurance companies. It's easy to get into the insurance field here, but didn't have a journey beyond that. I
Okay.
had an education and a career, and was trying to have that before healing. And
Okay.
in that journey of trying to heal from really severe traumas, I fell apart and relapsed again, ran away from Arizona and the support network I had here. And in 2020, I just had some very different experiences, very powerful experiences coming to know God. And He began, providing the faith that I didn't have
Mm-hmm.
and learning to know Him. And that helped me have the strength that I didn't have within myself to face my past and overcome it.
Okay.
And so now I've been back in Phoenix since April of last year of 2023. I was able to step right into the mental health field as a peer. So I
Okay.
initially was certified as a peer support specialist,
Okay.
and I was able to then work with the homeless demographic in Phoenix
Yes.
at low barrier shelters.
Okay.
Now, the difference in shelters is there's low barrier shelters and high barrier shelters.
Mm-hmm.
The high barrier shelters work with individuals that have an ability where they're currently at to come into a shelter setting and have extreme structure and
Mm-hmm.
betterment and different decisions. The low barrier shelters are geared more towards those who are still in active addiction,
Mm-hmm.
that may have a very violent past
Okay.
criminally. And so we give them a chance. The lower
Yeah.
barrier shelters, not everyone wants to run them, wants to facilitate them.
Mm-hmm.
The municipalities are very careful in giving those grants out,
Mm-hmm.
because you're dealing with a completely different demographic.
Mm-hmm. Mm-hmm.
For me, I was a volunteer firefighter in my very early 20s.
Mm-hmm.
And so it was just another adventure to get to go walk into and help that demographic in our society.
Right.
Um, but what I saw was a depth of the issue that I think I knew at some level was there, but I didn't realize how profound that it's there was until I was facing it every day
Yeah.
and just seeing where, kind of perpetual victims of the system, where if the system had been different for them 10 years ago or 20 years ago or
Right.
5 years ago,
Right.
they were in a place to have made different decisions in their life,
Yeah.
but there wasn't a service available to them.
Right.
And I
Right.
think it was probably, this is my assumption, but probably COVID that forced the cities and the state to look at service options to prevent a public health crisis of providing different services. that kind of forced the government to look more at homelessness and a public health crisis.
Okay.
And that was probably, I'm not sure, but I would imagine
Right.
when there was a shift dramatically in funding in creating shelters for the low barriers.
Okay. So on some level, we're also looking at a mental health crisis happening at the same time
Yes.
as we're dealing with all of this.
Yes.
And so this, from what I understand, is part of what previously used to exist, which was kind of the state mental hospitals.
The state institutions.
And so this is where a lot of mentally ill folks would wind up for many, many years.
Yes.
Why did that system end and kind of land us in the situation that we're in today with lots of mentally ill people on the street? And I think there's generally a fairly large percentage of unhoused folks are suffering from mental illness. And so, it's kind of the decay of this system here
Yes.
that precipitates a lot of what we're dealing with now on the street.
Yes.
Okay. So
to look at the failure of the system, you have to start with how did it happen
Yeah.
initially. So in the early 1900s was when really state institutions, in the late 1800s, probably after the Civil War, was when the initial government institutions or university institutions for the mentally ill started. And if you look at the history of psychiatry or psychology, some were incredibly ethical and good-hearted, and some wanted to be the mental health of Dr. Frankenstein. And so you had alcoholics forced to have frontal lobotomies and have their brain carved out. And that was a treatment for addiction in the early 1900s. You had in the Civil War, you had a lot of veterans from the Civil War becoming addicted to morphine. So it was the medical profession's answer for morphine. Let's create heroin. So that's where, heroin was created as a treatment for morphine. Just like Xanax in the early 70s, not Xanax, who was the first? Benzodiazepine, Valium. Valium was this miracle drug to help people not be alcoholics anymore.
Okay.
In the early 50s and 60s, I believe.
Yeah.
It hits the exact same chemical receptors in the brain as alcohol. So it's literally alcohol in a pill instead of in a bottle.
Okay.
And so it was the cure-all for alcoholism. Now, when used appropriately, it can help taper someone safely from alcohol under a prescribed environment, controlled environment, to detox safely from alcohol. The detox process for addiction is very dangerous, especially from alcohol, because of how it rewires the brain. You can genuinely have a seizure and die in alcoholic detox.
Right.
So that's the start of it. You fast forward to the 80s and 90s, and we have institutions like this prevalent in every state. And so where the system, when you would get to a point where the community, the church, the system, the field had failed you, this is where you ended up.
Yeah.
And so you would see individuals with an intellectual disability and maybe a co-occurring mental health diagnosis that would be placed in institutions like this because there was no caregiver. And off their medications, they became violent. And so they genuinely were in a place of needing supervision, but you have a system not regulated properly that becomes politicized in every cycle. And so generally with these types of systems, what you would see is before a large anticipated election, they cut funding for all services so that whoever is reelected or elected can then refund the same services and say, look what I did to better our community. That's the cycle of politics in these types of systems.
Okay.
So in the 80s and 90s, we start seeing advocates helping individuals file lawsuits against the states. And the states began losing lawsuits.
In part because there was
Because of
some amount of abuse inherent in such a large system.
Yes.
Okay.
Yes. So you'd have individuals trapped in the system. So say you're on disability. SSI pays, I believe right now, Social Security pays a disabled person that's never worked, a disabled adult, around $800 a month. I'm not sure the exact dollar amount. Might be a little more, might be just under that. There's nowhere in America you can live off $800 a month.
Right.
So you're at that point, if you're a disabled adult that's never had a capacity to work and you are dependent on the system, you have $800 at 18 years old to support yourself with.
Yeah.
And you are dependent on the government systems.
Yeah.
So we start having advocates filing reform lawsuits in the 80s and 90s, and the states are losing them because there's horrendous abuse. You have people that do not need to be institutionalized, that could live independently with supportive services, that are forced in an institutional setting with, I mean, you could see the gates. They don't have an ability to leave on their own accord. And when, with the right support system, they can make safe decisions. So those types of individuals were the ones I initially worked with before coming back out to Arizona when I branched into the mental health field during the middle of COVID. I left corporate America and became a direct support professional. So I went from $50,000 a year to $11 an hour. That was a hard reality check of, I've got great ideals. God, I need you to help me learn some new lessons.
Sure.
But I was working as a caregiver with 3 women with intellectual disabilities that had grown up in a system like this. They become part of a lawsuit that changes the system in the state I was living in at that time was Georgia. And they were 3 roommates in a home that a nonprofit was responsible for them and providing care. They had co-occurring schizophrenia or schizoaffective. Some of them had epilepsy as well. So very in need of responsible caregiving and ethics within that. And so each of them had been in an institution like this until the state shut it down, and then the nonprofit industry stepped in to provide supportive services. But before that, the Medicaid system caps out at $1 million payment. And so if they've been in hospital settings trying to get assistance to maintain medications that the community system is not geared for helping them with, so many of those hospitalizations inpatient rack up over the years. Medicaid caps out, and then the only way for them to receive services before these lawsuits in the 80s and 90s, they'd end up in a place like this, where if they had maintenance and mental health care, they could make adult decisions and at least provide for themselves in some capacity with support. So that's kind of what led to reform of the 80s and 90s. Initially, it did really well. There was more funding because of the lawsuits and federal judges and state judges saying you have to pour this much into the system. Well, then those rulings wear off. So now we have a new system and the funding begins to be lax again.
Right. Okay.
And there weren't lessons learned. There weren't services offered.
Yep.
In Arizona, one of the things that they instituted was a separate demographic within the mental health system that was based on symptomology, not a diagnosis. So the way that...
is that because it's hard to give diagnoses, or this is more just not having funding or laziness?
Bureaucracy, you mean?
Okay.
So how...
Structural inefficiency.
Right. How the mental health field works for a provider is currently there's the Diagnostic Service Manual, and it's the 5th edition.
Yes.
The 1st edition was published, I think, in the late 50s, and it was very small. Today, it's probably about yay thick, if not more.
Right.
And it's all of the diagnostic codes for the insurance company to know what they're paying for. It provides that accountability that's gotten extreme at this point.
Yep.
And so now there is a label for everything because you've asked for help.
Got it. Okay.
And so...
to some extent, because if there's not a label, then it's not something that can get funded for treatment? Okay.
Right.
Okay.
And so for the mental health field with the seriously mentally ill in Arizona, there's a separate system. It's called the SMI, or seriously mentally ill. And it's based off the symptoms and how severe are the symptoms impairing someone's life.
Okay.
And that was intended to open a door of additional services to them.
Okay.
And when it started, that's what happened.
In part because the shutdown of the mental hospitals here left a lot of people just in the lurch without options.
Yes.
And so then there was a lot of suffering. There were a lot of people just out on the street, and so there's a new system, this SMI system, that is getting created to help fill the gaps.
So there was the SMI system created. You also had housing voucher systems created. You had community health clinics being funded.
Okay.
You had reform coming into the Medicaid system to help mental health.
Okay.
Because we used to have the attitude of just pick yourself up by your bootstraps. This should not be an issue.
Right. Okay.
Then you also have kind of the very conservative Christian slant on things that you'll see in different areas of the country, of like, you just shouldn't need psychiatric medications, and can't you manage your emotions on your own.
Okay.
And so, and the whole thing is whatever leads to someone in their moment asking for help, they have a backstory that
Yep.
needs to be unwoven and in a supportive environment.
Yep. Sure.
And so what I've continued to see is where one system is determined, however it is, that it's not working. So then we throw a new solution into it, but there's not the middle of the road of phasing out. So like in corporate America, if I were on a team that were like, this is a massive problem, this is a money pit, we've got to fix it. They handle that responsibly because they have a board of directors to report to, they have investors to report to. But where the community is uninformed of these deeper seated issues, and they just see the problem and then it scares them. And so then the pulls become, how do we answer the problems? So if there is a massive money pit in corporate America, they'd create a team.
Yep.
And they'd create a team that could work together in cohesion and have a lot of different ideas and adjust quickly. But in the mental health field, generally, there are three types of mental health professionals. There are those incredibly good-hearted people that want to help and are equipped to and educated to and credentialed to. Then you have those like myself that have their own journey out of it and are reaching back to help pull someone out of it. And then the third demographic are those that want to be able to say they are helping because they do not want to have to admit they have a problem they need help with. And so those would be what many would term like the codependent or narcissistic behavior patterns that are detrimental in any workplace. And
but particularly
when you're in a vulnerable
mental health,
when you're working with a vulnerable population. And in homelessness, you're seeing the most vulnerable at-risk individuals that have some aspect of a horrendous backstory already. And are living in an active trauma dynamic. They don't have a door to shut at night. They don't have a wall around them to protect them from people. You can't come in my home.
Right.
And so
Okay, very interesting.